You are standing in a room that smells like copper and rot, and the man on the table in front of you is still conscious. His leg has been shattered by a fallen block of granite at the quarry. The bone is pressing against the skin from the inside. He is breathing in short, rapid bursts, gripping the edges of a wooden frame that has been pressed into his palms so he does not claw the attendants. And the person preparing to cut him open is not a doctor in any way you would recognize. He has no anesthesia, no sterile gloves, no surgical lights overhead. What he has is a copper blade, a pouch of powdered minerals, a chant he learned from a scroll, and a level of anatomical knowledge that will not be matched in the Western world for another 3,000 years. Ancient Egyptian surgery was real, it was sophisticated, and it worked far more often than it had any right to. And the moment you understand exactly how it worked, you will never look at the phrase medical miracle the same way again. The first thing that collapses when you study ancient Egyptian medicine seriously is the assumption that religion and science were enemies. In Egypt, they were the same thing. The physicians who performed surgeries were also priests. The temples were also hospitals. The scrolls that described how to close a wound with raw meat and sutures also described which deity governed that part of the body. That is not superstition contaminating science. That is a civilization that had spent 2,000 years documenting what actually worked and wrapping it in the only explanatory framework they had. What matters is that they documented it at all. Because when archaeologists began unrolling the Edwin Smith papyrus, first copied around 1600 BCE, but drawing on source material that appears to be at least 1,000 years older, they found something nobody expected. Case studies, 48 of them, each describing a specific type of wound or injury, the examination process, the diagnosis, the treatment, and a clinical judgment. An ailment I will treat, an ailment I will contend with, or an ailment not to be treated. That last category, the recognition that some cases were beyond intervention, is not primitive helplessness. It is triage. It is the same logic a trauma surgeon uses today when deciding where to allocate resources in a crisis. You would not have wanted to be the person these physicians practiced on first. In the earliest centuries of Egyptian medical tradition, the understanding of the body came almost entirely from the one context in which Egyptians opened human beings regularly: mummification. The embalmers who removed organs for preservation were not physicians, and the two professions were deliberately kept separate for ritual reasons. But knowledge leaked across that boundary. Over generations, the people responsible for treating the living began to understand what the dead had been showing them all along. They knew the heart circulated something through the body. They knew the brain existed and that injuries to it caused convulsions, paralysis, and changes in personality. The Edwin Smith papyrus contains the first written reference to the brain in all of human history, and it describes the surface of the brain as having the same folds and convolutions as the slag left behind when copper is smelted. Someone observed that. Someone wrote it down. Someone decided it was important enough to preserve. Now imagine being the patient rather than the observer. You have an infected wound on your forearm that has begun to smell wrong. The skin around it is pulling tight and hot. You have had a fever for 2 days. The healer who examines you does something that will strike you as almost familiar. He presses the surrounding tissue with 2 fingers, checks the color, smells the discharge, and makes a judgment about whether the infection is superficial or deep. He is doing what we would now call a clinical assessment. His tools are his hands, his eyes, and his nose. And remarkably, his conclusions are often correct because he has access to something almost no one talks about when they discuss ancient medicine. He has access to a pharmacopoeia that took centuries of trial and observation to assemble. and parts of it genuinely worked. Honey was used to dress wounds in ancient Egypt with a consistency that went far beyond cultural habit. They used it because they had watched it work. They could not have named the hydrogen peroxide it releases, or the low water activity that prevents bacterial growth, or the antimicrobial peptides it contains. But they knew that wounds packed with honey closed faster, smelled better longer, and killed patients less often than wounds left open or dressed with other materials. Modern wound care clinics use medical-grade honey for exactly the same reasons. The Egyptians were not lucky. They were observant. There is a significant difference between those two things. The situation becomes more disturbing when you arrive at what they actually did with blades. Egyptian physicians performed what the papyri call the opening of tumors, which in practice meant cutting into swellings, abscesses, cysts, and growths. They described the technique for probing a wound to assess its depth. They described how to handle a displaced jaw, a dislocated shoulder, a fractured nose. They had instructions for suturing wounds using linen thread, and separately for using strips of fresh meat as a biological bandage over wounds that were too large or too deep to close immediately. That last technique, the raw meat dressing, appears barbaric on its surface. What it actually does is provide a moist environment that protects new tissue and introduces certain compounds from the animal tissue that slow bacterial activity. It is not ideal by any modern standard, but it was not random. It was the best option available in a world where refrigeration, antibiotics, and germ theory did not exist. What made surgery survivable in ancient Egypt was not any single technique. It was the combination of careful observation, a functioning system of wound management, and something that is almost never discussed in popular accounts of ancient medicine: pain management that was more sophisticated than the popular image of a wooden stick to bite on. Egyptian physicians used willow bark, which contains salicin, the precursor to aspirin. They used opium derived from the poppy, the same plant that would eventually produce morphine and codeine. They used cannabis in certain preparations. They understood that making a patient calmer and less reactive during a procedure meant they moved less, bled less, and were easier to work on. That is not folk remedy logic. That is pharmacological reasoning applied to surgical practice, without any of the vocabulary we would use today. The deeper you go into what Egyptian surgeons actually did, the more uncomfortable a specific realization becomes. They were not working in clean conditions, and they knew the difference between clean and dirty mattered. Surgical instruments were copper or bronze, and copper has natural antimicrobial properties that the Egyptians did not understand biochemically, but observed empirically. Instruments were washed, hands were washed. The papyri are explicit about applying specific preparations before procedures, preparations that functioned as cleansing agents. They did not have the conceptual framework of contamination that Lister and Pasteur would develop more than 3 millennia later. But their behavioral practices produced some of the same outcomes because they were following the evidence of what reduced the rate of patients dying after you cut into them. The cases that haunt you when you read the primary sources are not the successes. They are the third category. Ailment not to be treated. A man has a skull fracture with bone pressing into the brain, and he is having convulsions. The physician examines him, records the trembling, the sweating, the fixation of the eyes, the inability to speak. And then he writes, "This is an ailment not to be treated." That is not ignorance or cruelty. That is a practitioner who has seen that outcome enough times to understand that intervention will not change it. The discipline required to acknowledge the limits of your skill, rather than attempt a procedure that will kill the patient faster, is its own form of medical wisdom. It took Europe's medieval physicians centuries longer to reach the same restraint. What you almost certainly do not think about when you picture ancient Egypt is the dental surgery. Skulls recovered from Egyptian burial sites show evidence of teeth that had been drilled, with small holes bored into infected molars that match descriptions in the medical papyri of procedures designed to release pressure from abscesses inside the tooth. They had no anesthetic capable of fully blocking dental pain. The patient would have experienced everything, and they went anyway because the alternative was an untreated abscess spreading infection toward the brain or the jaw, which killed people regularly. Think about the last time you sat in a dentist's chair under local anesthetic and still felt your heart rate rise. Now remove the anesthetic. That is what it cost to receive dental care in ancient Egypt, and people paid that cost because the physicians had demonstrated over generations that the procedure worked. The surgeons who performed amputations in ancient Egypt present perhaps the most striking evidence of how far that system had developed. Healed amputation stumps recovered from mummies show that patients survived the procedure long enough for the bone to remodel, which means weeks or months of post-surgical life. You cannot produce a healed amputation stump on a skeleton without effective wound closure, effective infection management, and effective care during recovery. All three of those things were happening. The patient was cleaned, the wound was dressed, the fever was managed. And in a world where one contaminated instrument could cause sepsis that killed within days, they were getting enough of it right, often enough, to produce evidence of survival in the bones themselves. The gap between what ancient Egypt was doing and what ancient Rome would do with surgery several centuries later is not as large as you might think. What separates ancient Egyptian medicine from what came next in many other civilizations is not the tools or the knowledge so much as the documentation. They wrote it down. They codified it. They created a system that could be taught, transmitted, questioned, and refined. When that system was interrupted by conquest, by cultural erasure, by the slow destruction of the library and the temple complex, what was lost was not merely history. It was a functioning infrastructure of medical knowledge that took the rest of the ancient world another 1,000 years to rebuild from the outside. Today, you can walk into a pharmacy and leave with something that will knock out an infection that would have killed a quarry worker in 3000 BCE without question. You can have a surgeon put you under complete anesthesia, open your abdomen, repair something that would have been a death sentence for 30,000 years of human history, and send you home 2 days later. The distance between that reality and a man biting down on a wooden frame while a copper blade opens his leg in a room that smells of natron and honey is almost too large to measure. But the people in that room were not doing nothing. They were doing everything they knew how to do, with everything they had observed over centuries of watching human bodies fail and survive, and occasionally, astonishingly, heal. If you had been lying on that table, the survival odds would have been worse than anything you have ever faced in a modern hospital. But they would not have been zero. And that gap between zero and something, maintained over 3,000 years of medical practice, is the most honest measure of what ancient Egyptian surgery actually was. If there is another civilization, another period, another ritual, another hidden corner of the ancient world you want to see reconstructed without the comfortable version, without the gold and the grandeur and the mythology scrubbed clean of everything real, leave it in the comments. The history that actually happened is always stranger, darker, and more impressive than the one that gets put on display.